Immunotherapy in oncology, mechanisms, applications, and clinical outcomes. Immunotherapy represents a paradigm shift in cancer treatment by leveraging the body's immune system to recognize and eliminate malignant cells. This approach offers improved outcomes across multiple cancer types. Understanding immunotherapy in cancer care. Immunotherapy has emerged as a transformative approach to cancer management, fundamentally altering how clinicians approach malignant disease. Rather than relying solely on chemotherapy, radiation, or surgery, immunotherapy works by reactivating or enhancing the body's natural defenses to identify and destroy cancer cells. This therapeutic strategy recognizes that cancer cells often evade immune surveillance through specific mechanisms, and by reversing these evasion tactics, physicians can enable the immune system to wage an effective battle against tumors. The success of immunotherapy across diverse cancer types has established it as a cornerstone of modern oncologic practice. The biological foundation of immune-based cancer treatment. The human immune system possesses remarkable capacity to distinguish between healthy cells and abnormal growths, yet cancer cells have evolved sophisticated mechanisms to hide from immune surveillance. Tumor cells frequently express molecules that suppress immune recognition, while simultaneously secreting factors that create a suppressive microenvironment surrounding the cancer. This immunologic tolerance allows malignancies to proliferate unchecked. Immunotherapy interventions interrupt these protective mechanisms, thereby exposing cancer cells to immune attack. By understanding the complex interplay between tumor cells and immune components, researchers have developed targeted approaches that restore immunologic memory and enhance the cytotoxic capabilities of immune effector cells. Major classes of immunotherapeutic agents. Key points: checkpoint inhibitors that block regulatory molecules preventing T-cell activation and allow immune cells to attack cancer. Adoptive cell therapies engineered to recognize and eliminate specific tumor antigens with enhanced persistence. Cancer vaccines designed to prime immune responses against tumor-associated antigens or personalized neoepitopes. Cytokine therapies that amplify immune cell proliferation and activation in the tumor microenvironment. Checkpoint inhibitor mechanisms and clinical applications. Checkpoint molecules function as brakes on the immune system, preventing overexuberant immune responses that might damage healthy tissues. Cancer cells exploit these regulatory pathways by expressing ligands that engage checkpoint receptors on T cells, thereby silencing anti-tumor immunity. Checkpoint inhibitor drugs block these inhibitory signals, unleashing T cells to mount sustained attacks against malignant cells. These medications have demonstrated remarkable efficacy in melanoma, non-small cell lung cancer, renal cell carcinoma, and several other malignancies. The clinical benefit extends beyond tumor response rates, as some patients achieve durable remissions lasting years or longer. However, the reactivation of immune responses carries risks, including immune-related adverse events ranging from mild dermatologic manifestations to serious organ toxicities affecting the lungs, liver, kidneys, or endocrine systems. Engineered cell therapies and personalized approaches. Adoptive cell therapy represents a highly personalized form of immunotherapy wherein immune cells harvested from patients undergo laboratory modification to enhance their ability to recognize and destroy cancer. The most clinically developed approach involves engineering T cells with chimeric antigen receptors that specifically target tumor-associated proteins. These modified cells demonstrate remarkable potency against hematologic malignancies, achieving complete remission rates exceeding 70% in certain B-cell lymphomas and leukemias. Expanded applications are under investigation for solid tumors, though penetration into these cancers and sustaining anti-tumor function in suppressive microenvironments remain significant challenges. The manufacturing process is labor-intensive and costly, limiting accessibility, but ongoing technological advances aim to standardize production and reduce expenses. Patient-specific variations in immune cell quality and functional capacity influence treatment outcomes, highlighting the importance of biomarkers predicting therapeutic response. Combination strategies and synergistic effects. Clinical experience has demonstrated that combining different immunotherapeutic approaches often produces superior outcomes compared to monotherapy. For instance, simultaneous administration of multiple checkpoint inhibitors can enhance response rates in melanoma, though with increased toxicity requiring careful patient selection and monitoring. Integrating immunotherapy with conventional treatments such as chemotherapy, radiation therapy, or targeted kinase inhibitors creates synergistic effects through multiple mechanisms. Chemotherapy can increase tumor immunogenicity by triggering cell death pathways that activate dendritic cells, while radiation therapy creates local inflammation that attracts immune effector cells. These combination regimens have expanded the populations benefiting from immunotherapy and improved survival outcomes across multiple cancer types. Sequencing and timing of these combined modalities represents an active area of clinical investigation. Predictive biomarkers and patient selection. Identifying patients most likely to benefit from immunotherapy represents a crucial goal in precision oncology. Several biomarkers have shown promise in predicting immunotherapeutic response, with tumor mutational burden and microsatellite instability demonstrating associations with checkpoint inhibitor efficacy across cancer types. Programmed death ligand 1 expression on tumor and infiltrating immune cells correlates with response to anti-PD-1 therapies in certain malignancies, though its predictive value varies by cancer type. T-cell infiltration patterns within the tumor microenvironment and specific immune cell populations show promise as response predictors. Genomic analyses revealing tumor-specific mutations that generate immunogenic peptides represent emerging biomarkers. However, no single biomarker perfectly predicts responses, and a multiparametric approach incorporating genomic, immunologic, and clinical factors likely provides optimal patient stratification. Ongoing clinical trials are evaluating novel biomarkers to improve treatment selection and minimize unnecessary exposures to ineffective therapies. Managing immune-related adverse events. The therapeutic benefit of immunotherapy comes with potential risks related to excessive immune activation and loss of immune tolerance to normal tissues. Immune-related adverse events represent the distinctive toxicity profile of immunotherapies, ranging from asymptomatic biochemical abnormalities to life-threatening organ dysfunction. Common manifestations include dermatologic reactions, gastrointestinal inflammation, hepatotoxicity, endocrine dysfunction, pneumonitis, and myocarditis. Management approaches depend on severity grading, with mild events often managed with supportive care and close monitoring, while moderate to severe toxicities typically require immunosuppressive interventions including corticosteroids or additional immunomodulatory agents. Most immune-related adverse events are reversible with prompt recognition and appropriate management, though some patients experience permanent consequences requiring long-term medical support. Healthcare providers must maintain high clinical suspicion for these complications and educate patients on reporting concerning symptoms to enable early intervention. Emerging immunotherapy strategies and future directions. The immunotherapy landscape continues to evolve rapidly, with novel strategies under active development to overcome current limitations and expand benefits to additional patient populations. Personalized cancer vaccines incorporating patient-specific tumor mutations represent a promising approach that could enhance immune recognition of individual cancer clones. Bispecific antibodies designed to simultaneously engage tumor antigens and immune effector cells offer potential advantages over monospecific approaches. Interleukin-based therapies engineered for improved safety profiles aim to amplify immune responses while minimizing systemic toxicity. Immunotherapy combinations targeting multiple pathways simultaneously may overcome resistance mechanisms that limit current monotherapy efficacy. Investigations into tumor microenvironment modification, including strategies to increase immune cell infiltration and reduce immunosuppressive populations, aim to improve anti-tumor immunity in difficult-to-treat malignancies. Machine learning applications are beginning to reveal complex patterns in patient characteristics and tumor features that predict immunotherapy responses. Resistance mechanisms and treatment resistance. Despite impressive clinical responses in many patients, a substantial proportion of cancer patients demonstrate primary resistance to immunotherapy or develop acquired resistance following initial response. Multiple mechanisms contribute to immunotherapy resistance, including acquisition of mutations affecting antigen presentation, selection of tumor cell populations with reduced immunogenicity, and expansion of suppressive immune populations within tumors. The tumor microenvironment actively contributes to resistance through production of immunosuppressive cytokines, recruitment of regulatory immune cells, and establishment of physical barriers limiting immune cell penetration. Cancer cells themselves evolve through immunoediting processes, selecting variants with reduced visibility to immune surveillance. Understanding these resistance mechanisms is driving development of rational combination approaches targeting distinct pathways simultaneously. Repeat tumor biopsies from patients with progressive disease on immunotherapy are revealing dynamic changes in tumor immunology and cellular composition that inform subsequent treatment selection. Clinical outcomes and long-term survival data. Clinical trials have demonstrated substantial improvements in survival outcomes across multiple cancer types treated with immunotherapy compared to historical controls. Melanoma patients treated with checkpoint inhibitors show 5-year survival rates approaching 50%, a dramatic improvement from previous era statistics. Lung cancer patients with high tumor mutational burden or specific molecular features derive significant survival benefits from checkpoint inhibitor monotherapy or combinations. Advanced renal cell carcinoma has been transformed by immunotherapy combinations, with some studies reporting median overall survival exceeding 2 years. These improvements have translated into regulatory approvals across numerous malignancies and progressively expanding clinical applications. The durability of responses in responders, with some patients remaining progression-free for many years, suggests potential for curative outcomes in certain populations. Long-term follow-up studies continue to refine our understanding of survival trajectories and identify patients most likely to achieve durable remissions. Conclusion: immunotherapy as standard cancer care. Immunotherapy has fundamentally transformed oncologic practice by offering patients novel mechanisms of anti-tumor activity with curative potential in select populations. The diverse toolkit of immunotherapeutic approaches enables personalized treatment strategies tailored to individual tumor and patient characteristics. While challenges remain regarding patient selection, resistance mechanisms, and adverse event management, ongoing research continues to expand the scope of immunotherapy applications and improve outcomes. Integration of immunotherapy with conventional cancer treatments and development of rational combination regimens continue to enhance clinical benefits. As our understanding of tumor immunology deepens and predictive biomarkers improve, immunotherapy will likely become increasingly central to cancer treatment strategies across malignancy types. Patients and healthcare providers should view immunotherapy as a valuable option for many cancers, though careful consideration of individual circumstances, expected benefits, and potential risks remains essential for optimal treatment planning. Thank you for watching. For the full article, visit MedMind AI at medmind.pro. Like and subscribe for more evidence-based medical content.